Hello and welcome everyone. I'm Garima Dugar, your host. I'm a core team member of Doctors for a Cause and also the mentor of the Academic and Educational Task Force. So this is Body Under the Lens, an integrated masterclass on the surgical and anatomical histology presented by Dr. Titankar Guha Thakurta, an MD Physiology and a teaching faculty at KPC Medical College and Hospital. I know many of you were excited, and so was I, for this masterclass by DFC. So, DFC is a non-profit, non-governmental organization working towards the welfare of the society in general. We are a body of medical students, interns, and young doctors based primarily out of Kolkata. So, one of the 8 task forces of Doctors for a Cause, that is the Academic and Educational Task Force, it has brought about this masterclass. So today's masterclass is on histology, which Dr. Titankar Guha Thakurta will take. I to start today's session without any further delay. So over to you.
As the participants must know that today's session is an integrated discussion on the histology that you learn in the first year and the histopathology that you are taught in the second year. Now, let me explain briefly to you how this class is going to happen. In the first half of the class, we will discuss the structure of various organs and tissues in the body as we see under the microscope. Now, once we are familiar with identifying the normal organs and structures under the microscope, we will introduce pathological processes to those structures and see if we can make a clinical or histopathological diagnosis out of it. So, I will explain this as we move on. Let us start with the process. So, the first part is anatomical histology. That is the study of tissue structure of normal organs and tissues of the body. Now, histology is very interesting because histology not only talks about how the organ is organized in terms of cells, it also talks about how it functions, because there is a structure-function correlation. In this workshop, I would try to discuss with you and try to encourage you to think from not only a structural but also a functional point of view, and that is what makes histology a living subject and not a morbid cadaveric subject. So let us start. We know that this slide is probably the simplest that you can imagine. This is something you have learned in your class 6 or 7 standard. We know that animal tissues are broadly of 4 categories: epithelial tissues, muscular tissue, connective tissue, and nervous tissue. Although the tissue composition of the body therefore tends to be very simple and almost similar for all mammals, it is their organization into the structure that makes them unique. For example, both tongue and quadriceps may contain skeletal muscle fiber, but the organization of the other components with the skeletal muscle makes a muscle tissue typically muscle and the tongue a tongue. Epithelial tissues, as you know, can be squamous, cuboidal, columnar, ciliated columnar, glandular. There is also one more type of epithelium called transitional epithelium that we find in the urinary tract. Muscle tissue can be striated muscle or skeletal muscle, smooth muscle, and cardiac muscle. Connective tissue can be fluid connective tissue like blood or lymph, skeletal tissue like bone or cartilage, and connective tissue proper, which are the packing tissues of the body, which include areolar tissue, adipose tissue, ligaments, and tendon. And finally, we have the nervous tissue, which consists of the connective tissue component called glia and the neuronal component, the neurons. So, what we are trying to say here is that essentially whichever organ in the body you are talking about or studying under the microscope, essentially it's an amalgamation, an organized presentation of these components. Except for some special modification of this tissue, we do not find more varieties in our body. It's a permutation and combination of these simple components that make every tissue and organ look as it is and function as it is. So before we start with identification of organs, let us quickly see if we remember how the fundamental tissues look like. And this will be a very interactive workshop. So I will expect all of you to participate liberally. Many of the questions that I'll ask you are in the multiple choice format, and you can answer simply by mentioning the option. So here comes your first question. So what is the lining epithelium of the structure that you are seeing? What you are seeing here is some kind of a structure. It has a lining epithelium. How will you describe this lining epithelium? Is it squamous, cuboidal, transitional, or columnar? So most of you think this is columnar epithelium, while some think that it may be transitional. Let us analyze, let us try to find out the findings. If you look carefully, you see, in histology, cell outline is not always properly seen. What we can see is the position of the nucleus and the overall impression of the cytoplasm. So you can see here that the cells are elongated. The height of the cell is definitely much more compared to the breadth of the cell. And the nuclei are more or less at the same level, indicating that it is a single file of cells, a single line of cells. Because of this can be best described as columnar epithelium. So this is columnar epithelium, which is liberally present on intestinal structures. It lines the stomach, it lines the small intestine and the large intestine. So this is how columnar epithelium looks like. Next question. What is this lining epithelium? Okay, so there is an unanimous answer from you. You think this is squamous epithelium, and you are absolutely right. These are the flattened squamous epithelium. One peculiarity that you see here is that it's not one layer of epithelium. It's multiple layers of epithelia that are stacked upon each other. And this arrangement is called stratification or layering. So this is an example of stratified squamous epithelium. Something that you get on those parts of the body which has to withstand a lot of friction. So it's present on the skin, it's present in the esophagus. So these are the areas where you get stratified squamous epithelium. Also, there is a peculiarity of this epithelium. You can see below there are slightly rounded cells. These are the basal cells. The basal cells differentiate and move upward. And upward, the cells become more and more flattened, and the nuclei become less and less distinct. For example, in skin, the uppermost layer may not contain nuclei at all. So this is a peculiarity of stratified squamous epithelium, and this arrangement always indicates that there is a stratification process on. Next question. You can see some muscle fibers running here in long section, also in cross section. What do you think best describes the muscle? Is it skeletal, cardiac, smooth, or a mixture of different kinds of muscle? So we are getting different responses. Most of you think this is skeletal muscle, whereas some are going for the other options. Now look carefully, let us characterize the muscle. In this magnification at which we are looking, we are not able to see finer details of the structure. But this is the magnification that we commonly use, so we should get gradually used to that. As you see this bundle of fibers running, if you look very carefully, you should be able to identify there are striations. So there are dark areas and pale areas. So this is a striated muscle. But there is no interconnection between the individual fibers, making it a syncytium, nor can we see any interconnected disc. So probably this is not a cardiac muscle. A smooth muscle consists of small spindle-shaped muscle fibers and not long syncytial fibers like this with multiple nuclei on its surface. This appearance is typically the appearance of skeletal muscle, and this is how skeletal muscle is identified. The small portions that you see here are transverse sections. So they are basically cutting through the belly of the muscle. That is why they are looking rounded. And the elongated fibers are the long sections or oblique sections of the muscle. So this, you remember this image, this is the typical appearance of skeletal muscle fibers. What muscle do you think this one is? This whole pink area. So most of you are of the opinion that this is smooth muscle, and you are absolutely right. This is smooth muscle. Each nucleus is contained within a single spindle-shaped cell, and they are bundled together in the form of a visceral smooth muscle. You can also see it's lining some kind of a gland, and the muscles in association with glands or ducts are usually smooth muscles. So there are many clues in a picture. When you look at histology, every picture tells you a story of that organ, of how it functions. And that correlation is very important while understanding histology. You can see here, we have shown here some glandular epithelium. Some pale cells have been labeled by an arrow. What is the name of these pale cells? The colorless cells that we are seeing here. Wonderful. These are called goblet cells or mucus cells. Because mucin does not take prominent hematoxylin eosin stain, so the cells look empty. Now, remember this also, therefore, if a gland looks as if it is lined by pale white cells, then it is likely to be a mucus gland. On the other hand, if a gland contains zymogens, which usually take up strong basophilic or some kind eosinophilic stain, then those colorful cells lining the gland is likely to be a serous gland. So a gland can be termed as serous or mucinous based on its appearance also. Because if the appearance is pale, it definitely contains mucin. If the appearance is colorful, it contains stainable proteins, and therefore it might contain zymogens, and it might be a serous gland. What tissue is this? Wonderful. So this is adipose tissue. You can also see a band of fibrous tissue running through this. And this small structure, this round structure, can you say what this structure might be? This small round structure below the fibrous band, what might it represent? Think of what cylindrical structure might pass through the adipose tissue. Wonderful. So this is some kind of a blood vessel. And the violet cells that are lining the inside of the blood vessel, they are the endothelial cells. Can you identify the tissues labeled A and B? What kind of tissue is A and what kind of tissue do you think is B? A is smooth muscle. B typically is hyaline cartilage, where you find a bluish tint in the hyaline matrix, in which there are lacunae containing cells and some empty lacunae as well. Finally, can you tell me what is A, what is B, and what is C? By B, I actually mean this round structure, this star-shaped structure. Okay, so let us try to solve this. This is very interesting because these three elements may be present in any organ. A and B, you can see these are hollow structures. It may or may not contain blood cell inside it. So these are hollow structures. A is a stout round structure with a thick muscle wall. So it's likely to be an artery or a branch of an artery. B has thin wall and the shape of the wall is not maintained. So it's spatulous. So it's likely to be a vein. All around there are adipose tissues. But this C structure is very interesting if you see. The structure C, if you look carefully, it is some kind of a cylindrical structure which in the cross section is appearing circular. And this cylinder has an outer connective tissue layer. You can see the connective tissue layer outside. Inside, there are multiple compartments or septa. And each septa contains small round dots. That means there may be multiple thin cylinders passing through this big cylinder. And some of those cylinders do not take stain. That is why they are appearing white in color. So it must be a nerve that is lined by myelin sheath, which is not taking color. And these bundles of myelinated nerves are encased within the layers of nerves like the epimysium, etc., epineurium, etc. And finally the perineurium covers it all. So this is how nerves looks like. In anatomy also you learn that nerve and vessel can move together in the organ. And these are known as neurovascular bundle. So this is actually how magnified cross-section of a neurovascular bundle looks like. Try this one. I'll tell you that this is very easily a biopsy of the skin. So that is not my question. In the skin, what does A, B, C and D represent? So let's go one by one. What is A? Very good. So A is the superficial keratin layer of epidermis or the stratum corneum. What does B represent? This circular structure with a hollow core. What is probably B? Okay, I got your answers. So you are divided between glands and blood vessels, etc. Let's go one by one, step by step to understand this. It has a hollow core. So it may be something spherical or cylindrical. All around we see multiple cells lining it. Had it been a blood vessel, it should not be lined by multiple cells. Also, the hollow portion is not lined by any epithelium. So then it cannot be a gland. A gland must have a lining epithelium. So what is this cylindrical thing that stains pink, is surrounded by cells and grows as a long cylinder? This is the base of a hair follicle. And this pink material is keratin. You'll see its color is same as the color of the stratum corneum, indicating it's the same chemical. So it is a keratinous outgrowth of the skin. This appendage represents the hair follicle. Now comes C. C contains multiple cells and therefore it may be a gland. But it is such a gland which is not taking up the same property. You can see that the cells are very pale. Please keep your microphone in the mute mode. Okay, so you can see that the cells here have not taken proper stain. Hematoxylin eosin is a water-based stain, so it cannot stain something that is rich in lipid. So it must be a gland in the skin that secretes lipid-rich substances, and therefore these are sebaceous glands. Now guess, what is the structure coming out of the hair follicle and running through the sebaceous gland into the depth of the dermis? What is this pink fiber? Think from a very physiological point of view. Wonderful. This is the adductor pylorus or erector pylori muscle that helps the hair to raise up and gives the so-called goosebump. Wonderful. So see, if you can imagine how the organ functions and correlate, guessing the part is not very difficult. It's all there in the slide. You just have to make sense of the structural organization. The last one. You see here, there are structures labeled A, B, and C. What do you think are, I'm not talking of the organ, I'm only asking for the structure. What structure does A represent, these blue things? What structure does B represent, the white clusters? And what does C represent, this whole thing, the round thing? Wonderful. So A is a cluster of cells that stain darkly, so it is probably a cluster of Serous gland, and each round structure is an acinus. B also represents acini of glands, but these glands have pale cells, so they are probably represent the mucous glands. And this epithelium-lined round structure is probably the cylinder through which the secretions are drained. So this is a duct, and therefore indirectly we can also say that we are dealing with an exocrine gland here because it has a duct. You can see another duct just below. So these are all ductules or branches of a duct that will join to form some kind of a bigger duct. Wonderful. With an idea of these individual tissues, now I will show you structures. You have to name the organ. But mind you, I'm not asking you to memorize and name the organ. Deduce it scientifically. So, okay, Shrirupa, you are asking why this cannot be an artery. The reason is, artery is lined by smooth muscle. It is lined by a single layer of columnar cell. There is no smooth muscle around it, so it cannot be an artery. Also, endothelial cells are not columnar. They are flattened, epithelium-like. Okay, so now I will show you biopsies or histopathologies or histologies of different organs. There is no pathology in the organ. These are all normal organs. So you will try to deduce what organ that is. And to help you, I might give you hint, not by naming the organ, not by giving any hint of the function of the organ. I will only give you hint on the different components that you see on the slide. So for you, I can identify the components that we see. You imagine in your mind in which organ of the body these components are present together. So that way you think and try to find out an answer. Now here there is an organ. Try to identify this organ. Now there are three components you should see. There is a right hand side, there is a middle part, and there is a deeper left hand side, and with some fibers running side by side. So think which organ can have all these components. Just to make things easy for all of you, you can also help each other. Can you name the kind of lining cell that this one is, this upper blue part is? What is the lining cell in the upper blue part? So I don't want the name of the organ. It is stratified squamous epithelium. Now think in this way. What are the organs of the body that have stratified squamous epithelium? Skin, oral cavity including tongue, esophagus, and the external genitalia like the cervix. So it has to be something out of this, because no other organ has stratified non-keratinized epithelium. Now, then comes a portion where loose tissue is present, followed by some muscle fiber. Do you think these muscle fiber, look at the density and the stoutness of the fiber and tell me, do they look like skeletal muscle or smooth muscle? Fine. So, now we are ruling out one by one. So first of all, it cannot be skin, because under the skin there should not be any muscle. It cannot be cervix, because there is no skeletal muscle under it. There is smooth muscle under it. It cannot be esophagus, because esophagus is, inside the esophagus you have layers of circular and longitudinal smooth muscle. The tongue is moved voluntarily. You can move the tongue in any direction you want. So tongue must contain skeletal muscle fiber. So a non-keratinized epithelium, underlying which there are skeletal muscle fiber, has to be tongue. But then you need corroborative proof. You can also see small glandular structures here. Can you name any small gland that can lie scattered in the tongue substance? The accessory salivary glands, yes. So the accessory salivary glands, which are also mucous in nature, these glands may lie there. So the presence of stratified squamous epithelium, non-keratinized, underlying skeletal muscle tells you are dealing with tongue. That is further proven by the fact there may be scattered glands here and there. So maybe you are right, this is the tongue. So this is how the histology of tongue should look like. And these are the components we should look for. Next slide. Identify the organ. I can repeat the slide also sometime. So you try to identify these organs. Again, do not jump into conclusion. Go point by point. First tell me, what is the lining epithelium that you see here? You try to answer my question, you will automatically identify the organ. Yes, it is also stratified squamous. It looks like skin, only that there is no keratin there. So this is stratified squamous epithelium. Now, below the stratified squamous epithelium, there is a loose area containing some violet dots. What can the aggregates of violet dot called? What are these? Wonderful. So these are lymphoid follicles or lymphocytes. We know lymphoid follicles are present throughout the submucosa of different organs. So in the GI tract, it is called GALT or gut-associated lymphoid tissue. In the bronchus, it is called BALT or bronchus-associated lymphoid tissue. Likewise, they are all different kinds of mucosa-associated lymphoid tissue. So we are dealing with an organ where there is a stratified squamous epithelium with some kind of a mucosa-associated lymphoid tissue, so which there are glands. Now up to this can also technically, but then there is no skeletal to be found. Instead you find smooth muscle layers lying over here, and there are large number of glands present here, not just scattered glands. So you are dealing with some part of the GI tract with mucosa, the entire submucosa containing lymphoid tissue and glands, and a muscular layer. And if you move the slide, you will be able to see the serous layer also. So now think of the part of the GI tract which has the 4 layers and is lined by stratified squamous epithelium. Wonderful. So this must be the esophagus. So this is how you identify. It is not about the right diagnosis. It is about the right way of diagnosis. I'll show you another organ now. Identify the organ. Again, don't jump into conclusion. First tell me, what is the lining epithelium? What kind of cell is lining the outermost part of the organ? Is it squamous? Is it columnar? Is it cuboidal? What kind of epithelium do you think it is? Columnar. And they are also forming glands. We can see the rounded and elongated structures. Now, there is a thick layer, a dense layer of glands, as you can see. A typical description would be the glands are packed into the mucosa and submucosa. And after the submucosa comes the smooth muscle layer. You can easily identify the smooth muscle. So, which part of the GI tract, now see, we are ruling out things. Which part of the GI tract is lined by columnar epithelium? It can be stomach up to above the anal canal, any part, up to the end of the colon. All parts are lined by columnar epithelium. Then, which part does not contain any villi? Other than intestine, no one contains villi. There is no villi here, so this is not intestine. Which part does not contain crypts? Crypts are present in the large intestine. You cannot see long crypts going into submucosa. So probably we are not dealing with large intestine. So we are left with the option that this might be stomach. Stomach typically presents with closely packed glands, and below which there is submucous layer. And you can also see gastric pits, which are small crypt-like structures running deep into the mucosa. So this is the stomach. As we go towards the antrum, the size of the gastric pit increases. It can partly confuse you, thinking that this may be the large intestine or small intestine. Don't get confused, because you will, as you move the slide, you will see on one side these will disappear, on one side these will elongate. That means you are moving more towards the antral end, and it still remains the stomach. This is very easy. Identify the organ. Very good. This is the small intestine. You can see the prominent villi, below which there are submucous glands, also called the Brunner's glands, and below which there are two layers of smooth muscle. Now, I hope you can see the pointer that I am using. Can you identify this structure which is coming down like this? What is this structure? One who said lymphatic, it's well tried, but it's a fibrous structure. You can see it's a thread-like structure. Multiple thread-like things are coming down. It is not a hollow structure. Yes, it is a nerve. It's one of the enteric nerves. So above lies this one is the submucous plexus, and this is the myenteric plexus. This might be some connection between the two. So we can see the submucous plexus and the myenteric plexus here. This is not large intestine, because in large intestine villi are not present. Villi are inverted. They don't go from inside outward, they go from outside inward, as we shall see. This is a more magnified picture. You can wonderfully see the villi lined by tall columnar epithelium. What is the name of the tissue that is present inside the villi? This tissue consists of small blood vessels and loose tissue. This is called lamina propria. Ankit, you were asking about lacteals. Can you see the pink vessels here? These pink vessels are the cross sections of the lacteals. Lymph is slightly alkaline in nature, so it takes up the acidic diuresil and becomes pink in cross section. So these pink dots that you are getting here are cross sections of the lacteal vessels. This is a far more magnified view showing goblet cells and other non-goblet columnar cells. Identify this organ. Look at how things are arranged here. Wonderful. See, you see here that instead of going out, the projections are inward. These are called crypts. So crypts are lined by goblet cell, as you can easily identify. So they have lubricating function as well. Below which there is a lamina propria and submucous layer, and there are lymphoid follicles. This is typically how large intestine looks like. So this essentially is large intestine, where instead of villi we have crypts. I'll show you a better diagram which is easier to identify. Look here. Instead of going outside, the cells are ejaculating inside. Can you hear me? Okay, fine. So, and there are goblet cells present abundantly on this lining mucosa. You can see the lamina propria is there, which is containing various interstitial cells, and this is exactly how the large intestine looks like. Identify this organ. Very good. This was actually very easy. This is such a small organ that the cross-section can be seen as a whole. And there is a central lumen and 4 layers of the cut. There is the pharynx mucosa, the submucosa containing lymphoid follicles, muscle layer, and the outer very thin layer that you can see is the serous layer. Can someone tell me which part of the organ is labeled by 1, where 1 is written? Look at how it is arranged and you will be able to answer. Very good. It is the mesoappendix or the mesentery. You can see the serous layer coming in and getting reflected on itself. This is the point of reflection. And there are also blood vessels coming through the mesentery, as we can see. This probably is the branch of the appendicular artery. Very good. What are these white things surrounding the leveling 2? These white areas, can someone say? What do these white things represent? Very good, fat cell. Goblet cell cannot extend. This is from interesting finding. It's good that you asked. Goblet cells cannot be present beyond the submucosa. If a columnar epithelium or gland or goblet cell is found in the muscle layer, except for some special situation, it always represents a cancer or an adenocarcinoma, because glands are not present in muscle layer, except for some histological aberrations that I'll discuss later. In general, it means it is an adenocarcinoma. So you should not get goblet cell in the muscle layer. These are adipose cells, and fat is normally present in between the fibers of smooth muscle. So this is the appendix. At a greater magnification, you can actually see the large intestine-like glands showing crypts. Lymphoid follicles are very prominent here. There are many submucous glands. You can also see the adipose tissue here prominently with blood vessels around it and smooth muscle layer. If you look into one of the lymphoid follicle, you will see it's arranged as perfectly as in a lymph node. So there is this epithelium level 1, a cell of mixed cells in zone 2. 3, this dark area level 3 is called the mantle zone. And this mantle zone typically contains the small B lymphocyte. 4 is the pale area or the center of the lymphoid follicle that contains the developing B cells called centrocyte. And the entire area called 5 that is surrounding it is the T lymphocyte area. That is how the immune cells are organized in a lymphoid system. Now try to identify this organ. We have identified the structures before. Try to identify which structure or organ contains these components. Fine. So this is a structure which shows the blue colored serous glands, the pale colored mucous glands, and also multiple exocrine ducts that are separated by fibrous septa. This kind of a structure is typical of salivary glands. Now we know there are three main salivary glands. The parotid, the submandibular and the sublingual differ in the composition of the nature of the gland. In submandibular gland, there are almost equal amounts of serous and mucinous components. So this is probably the submandibular gland. Whereas, if most of the structures are blue, that is like this, if serous, these are adipose cells. So if most of the glands are serous, then probably we are dealing with the parotid gland. And if most of the structures are mucinous, then we are probably dealing with the sublingual gland. So this is how we can differentiate, but at least we should be able to say that this is a salivary gland. This is very typical, so identify this organ. Only one organ in the body has tissue structure like this. Yes, think polygonal cells arranged in cords. This is so typical of hepatic architecture. You can see at one end there is a vessel, a single vessel. On the other end there are multiple round structures. So the area with a single vessel, what does that represent? Very good, that is the central vein. And the area around which there are many round structures, that is the portal triad. Sometimes the liver is histologically divided into zone 1, 2 and 3. That is area close to the portal triad, periportal area, intermediate area and the perisinusoidal area. This demarcation helps in understanding the nutritional and oxygen supply to the liver. You can easily understand the area close to the portal triad has maximum privilege. It has maximum concentration of food as well as oxygen. And the area close to the sinusoid or central vein is most impoverished. It has the least supply of food and nutrients. And this is important in understanding the disease processes of liver. Look into this organ. It's an organ densely filled with cells. There is also a duct-like structure, so it may be an exocrine gland, but there is a unique collection of cells by the side, which looks totally different, and is filled with blood vessels. Before I answer this, there is a question in the chat box. So you are asking whether mucin can be stained. Mucin can be stained in a very pale way with hematoxylin eosin. Proper staining of mucin requires either R-iodic acid sheet stain or it requires the Alcian blue stain. Yes, you are right, absolutely right. The blue round structures are of course the serous glands, and these serous glands, as you can see, are connected ultimately to this very thick duct lined by cuboidal epithelium, and therefore this is the exocrine part of the gland. And there is a cluster of cells, as you can see here. There is also a small cluster here. So these clusters are of independent cells that drain into blood vessels. So this is the endocrine part. So we are dealing with a mixed gland, and this is probably therefore the pancreas. At a higher magnification, this is how the islet of Langerhans looks like. the central portion are the islets of Langerhans. If you use immunological stain, you can differentiate between the alpha, beta and delta cells. And the surrounding cells are serous cells, forming the acini. If you enlarge the acini, this is how the acini look like. These are cells clustered together forming glands, and they finally drain into small ducts. This is the ductule lined by cuboidal epithelium. Identify this organ. An organ that has villus projection, but just below the villus there is smooth muscle. There is no submucous layer. Very good. This is the gallbladder. Gallbladder does not have a submucous layer. It also does not have muscularis mucosae, but that is difficult to see in low power. What is very obvious here is that there is no submucous layer, no lymphoid follicle, no gland. Directly below the lamina propria, you get thick bundles of smooth muscle. And so when you get an undulating mucosa, irregular mucosa, and just beneath that there are a thick smooth muscle layer, you are dealing with gallbladder. This is another picture of the gallbladder in higher magnification. You can see the tall columnar epithelium lining it, and below which the smooth muscle layer starts. Identify this organ. Identify the components first. There is a lining epithelium. Identify that. There are some glandular components. There is one different connective tissue component and another kind of a tissue component. Very good. So we have ciliated columnar epithelium arranged in a pseudostratified manner, below which you can see these blue things. You already know that they represent glands, and the white things are the mucous glands. So there is a mucosa. You can see above there are serrations. It looks irregular. That means there is a ciliated mucosa. Then you get a large number of glands. The most distinguishing feature here is the hyaline cartilage. Because hyaline cartilage in your syllabus at least is not present in any other organ other than the trachea. So if you see hyaline cartilage, at least for the examination purpose, you can see its trachea. To add up to this, you can also see smooth muscle running below the cartilage. This is the bronchial smooth muscle. Now let me ask you one question and you will easily understand. If I ask you, name one organ of the body where in the same organ you get columnar epithelium, glands, cartilage and smooth muscle. There is only one such organ, that is trachea or bronchus. So it is either trachea or bronchus. And if it is a bronchus, it must be up to the terminal bronchiole, because below that cartilage is lost. I hope this is clear to everyone. If you zoom in, I'll come to the other findings later. So try to identify this organ. There are multiple air spaces with tubular structures in between. So what does it represent? Wonderful. This is the classic appearance of lung. These geographic areas, these small pockets of air, these are the alveoli. And the round structures are the bronchioles. So you see, if I zoom in, this is how bronchioles might look like, attached to blood vessels. And the alveoli always look like an interconnected network. This gives form of epithelium but non-stratified. This is a closer view of a bronchiole, which is lined by ciliated columnar epithelium, and around which there is bronchial smooth muscle, which can contract and relax, changing the diameter of the bronchus. Can you identify this slide where there are multiple round tubular structures and some collections of structures surrounding which there is a gap and a capsule? This is the kidney. The structures that you are seeing as round structures are the glomeruli. The white area is the Bowman's space, and the outer margin of the Bowman's space is the Bowman's capsule. And all the small cross sections are renal tubules. But we know that one glomerulus gives rise to one renal tubule. So how come there are only 4 or 5 glomeruli in the picture and there are more than 50 to 60 tubules? How is that possible? Very good, because they are convoluted tubules. When a convoluted tubule is cut, multiple sections can be obtained. And this is also a clue that you are dealing with a structure where the tubules are convoluted. So it is kidney. Very good. In a different view, again, these are the glomeruli you can see, and all the small openings are the tubules. This is a more magnified view. You can see the glomeruli with the Bowman space all around it. And all these round structures are tubules. The reddish structures are blood vessels. Identify this organ. You can understand it's a luminal structure. So it may be GI tract, it may be urinary tract, it may be reproductive tract. These are the tubular organs of the body. The lumen looks like a star, and it is densely surrounded by smooth muscle layers. Yes, this is the typical appearance of the ureter. A cross section of the ureter is like a star, and you can at least say that why is it not some other tubular structure? The answer lies in the fact that if you look under high magnification, you will see that the lining epithelium is a transitional epithelium, having multiple layers of cells. It is not columnar epithelium, so it is probably not GI tract. So transitional epithelium appears only and only in the urinary tract. Otherwise, in a spotting slide, just looking at the star-shaped lumen surrounded by the smooth muscle, you can easily guess that you are dealing with the ureter. Identify this organ. So let us see the components. You can see above there is transitional epithelium. Below there is loose tissue followed by smooth muscle. And one interesting part is that above there are some epithelial cells that are bigger, often called the umbrella cells, that help in the stretchability of the organ. And this describes the urinary bladder. The urinary bladder has a layer of transitional cells or urinary epithelium, above which there are flattened cells called umbrella cells, below which there is lamina propria and the detrusor smooth muscles. Can you identify these organs? Yes, you can see there are multiple tubules. So it must be an organ having multiple tubules. These multiple tubules, you can see, are lined by some fibrous tissue, connective tissue, inside which there are cells in various stages of development, from larger nuclei to smaller nuclei. They are arranged in various stages. So these are the cross sections of the seminiferous tubule. And inside you are getting various stages of spermatogenesis. So this is the cross section of testis. At a greater magnification, you can see cells that have dark nucleus are probably the primary spermatocytes, and those with paler nucleus are probably the secondary spermatocytes. some of the dots that you see in the center with elongated tail are the mature spermatozoa. Interstitial cells of Leydig are not very prominently seen here, but with spatial stain, you can see in between the tubule there are clusters of cells. So some of these clusters may actually represent the interstitial cells of Leydig. This is another way of looking at it. There are different spiniferas tubules, outside which there is a connective tissue capsule. This is the tunica epithelium, if you see the corner of the slide. Identify this organ. It looks very much like the ureter, except that the epithelium is probably not transitional. Such a tubular structure that might have a lining like this may be either fallopian tube or vas deferens. But remember, fallopian tube is extremely convoluted. It is not a flower-shaped or a star-shaped lumen that you get there. So this may be the ureter or this may be the vas deferens. Let's check. When you go into the high power, you see it's lined by two layers of cell, not by transitional epithelium. And these two layers of the cell are one basal layer which looks like a dot. It's like a cuboidal epithelium, and the inner columnar epithelial cell layer. So therefore, this is the vas deferens, which is identified by a luminal structure that is surrounded by smooth muscles. And the epithelium is not transitional epithelium. You have already seen transitional epithelium. So transitional epithelium has multiple layers of cells in it, and they have a stretchability that makes them transitional. So some cells are elongated, some are vertical, so they have the ability to bear stretch. So this is the urinary epithelium. If you look into this epithelium and immediately then look into this epithelium, this is definitely not the same epithelium. It is a two-layered epithelium, and there is a basal and a columnar cell layer. It looks very much like the prostatic epithelium actually, and therefore this is the vas deferens. You can also see the thick smooth muscle layer, the inner circular and the outer longitudinal smooth muscle layer. Can you identify this organ? An organ with a fibrous and muscular stroma and multiple glands that look like stars or flowers. This is the typical appearance of prostate and not uterus. In uterus, the endometrium is lined by a single layer of cells. If you see the prostate closely, it is lined by two layers of cells, one basal and one columnar. There is one basal layer lying below and one columnar layer lying above. Also, this appearance has to be understood. This appearance is not like uterine gland. I will show you the uterine glands. They look totally different. You can also see the smooth muscles here move in various directions all around the gland. But in uterus, they don't move in different directions. They move in a unified direction so that it can contract properly. This thin concretion within the prostate is called corpora amylaceae, which is nothing but the condensed secretion of these glands. Can you identify this organ? It's an organ with a dense stroma, multiple round structures which are small, and one round structure that is big. This is very good. So this is the ovary. This is typically how ovarian stroma looks like, a compact, dense stroma. You can see here these small round areas with small cells inside it. These are the primordial follicles. And this is the developing follicle. This round big thing inside. This is the developing follicle. This is another high power view where the primordial follicles are looking slightly bigger. This is typically how the ovarian stroma looks like. And you can see here developing a follicle inside granulosa cells. This is how the developing follicle looks like. Identify this organ. A tubular structure lined by smooth muscle, the inside of which is so convoluted that it's difficult to find out where the lumen is. This kind of convolution is the typical reason of having fimbria or villi inside it. And therefore, this is the uterine tube or the fallopian tube. Now you can compare and easily understand why I said that looking at the vast difference, you should not confuse with fallopian tube. Vast difference has a very simple undulation. It does not look so complicated like a maze or labyrinth, but you can see a very labyrinthine pattern of convolution that is present in the uterine tube. It's so characteristic that if you see it once, you will not forget it. So this is how the uterine tube or the fallopian tube looks like. If you look very closely, the uterine tube is lined by columnar epithelium. There are cilia on top of this that help in movement of the ovum. There are some unique cells in between that do not contain cilia but some protrusions. These cells are called PEG cells, PEG. The PEG cells secrete some chemicals that help in capacitization of the spermatozoa. Can you identify this organ? A background of dense smooth muscle and outside which there are layers of glands of different sizes. This is typically how the uterus looks like. The outer glandular portion is the endometrium and the muscle layer is a myometrium. So this is the endometrium and the myometrium. When the ovum is in developing stage, that is the follicular stage, it secretes estrogen, and at the effect of which the glands become round, stout and cellular. This is called the proliferative phase of the uterus. And when the corpus luteum develops after ovulation, progesterone is secreted. The progesterone makes the glands tortuous and elongated, and that is known as the secretory phase of the endometrium. So the nature of the gland might vary, but ultimately you will get endometrium with different glands and a thick myometrium, which is the smooth muscle. Can you identify this organ? This organ is a cross section. That means there are multiple elevations. You have cut through those elevations. This is a bit difficult, so I'll give you hints. Look into the structure of these. The central part is myxomatous, jelly-like. And outside you see there are two layers of cells, an outer uniform syncytial layer and a inner dotted cellular layer. So what organ are we dealing with? That there is a syncytium, there are small cells, and also there are a central stroma. And in between these parts there are empty spaces where blood can circulate and exchange nutrition. So this is the placenta, and what you are seeing here are cross-section of the cotyledons of the placenta. Look at this picture again, it's similar also, it's in a more developed stage. You can see the individual cotyledons of the placenta. It is highly vascular now, and outside there are small dots. This is the cytotrophoblast. Syncytial trophoblast has disappeared. But in the early stage, syncytial trophoblast remains, This outer uniform pale area, this is the syncytiotrophoblast. This is the syncytiotrophoblast. And the inner granular area is the cytotrophoblast. This is very easy. Can you identify this pretty face? What does it represent? An organ with 3 round structures. 2 of them are stout, 1 of them is papular. Very good. So we are dealing here with the umbilical cord. There are 2 umbilical arteries and 1 umbilical vein. And the central ground substance, what is the name of that substance in which they are all embedded? Very good. It is called Wharton's jelly. So this is a typical picture of the umbilical cord. Inside the arteries, you can see blood has thrombosed. To be seen also. Can you identify this organ? Look into the components of the organ and that will give you the clue. There is abundant fat or adipose tissue in the organ, abundant fibrous matrix in the organ or stroma, and there are also glands. So gland, fat and fibrous stroma. Which organ has all these 3? Very good. This is the breast. This is the breast or the mammary gland. The glands can also become clustered and grouped together in acini if they are not isolated. So a stroma, gland and adipose tissue tells you this is mammary gland. Ideally, you should not confuse this with anything else, but sometimes looking at the shape of the gland, you may be confused if you are dealing with prostate. Because sometimes prostate and breast histologically look similar. Because there is a fibrous stroma and there are also glands that may be papillary in projection. In case there is a confusion, if you look very carefully into the gland or in the high power, you will see, look here, you can see the end of the cell are elevated. Can you notice that? That the end of the cell are irregular, as if they are projecting into the lumen. They are not smooth. There are some glands which perform their secretion by pinching out a part of the cell membrane. That is called apocrine gland. Breast is an apocrine gland. So if you look in high power, you will be able to see apocrine changes, and that will not be present in prostate. That is how it can be differentiated from prostate in case if there is some confusion. So I hope it is clear up to this. Now comes the most important question before we start the next part. How do you remember all this? What is the way of remembering how to diagnose a slide in 30 seconds or 1 minute? Now, I'll be very honest with you. There are innumerable tissues in the body. So, the first thing that you must do, whether you are in the first year or in the second year, to learn to diagnose in 30 seconds, you must first know what are the topics that are there in your syllabus. If your syllabus does not have the topic of, say, brain, then you should not think of brain. So it totally depends on what your syllabus contains. That is how you do a differential diagnosis and try to think whether it matches with the topic in your syllabus or does not match with the topic of your syllabus. That is the easiest way to diagnose. And you keep on looking at the images again and again from various perspectives, from various images at the low power magnification. One big mistake that I have seen students do often is that they think that identification will be easier in higher power. That is not the case. If you look at the mountain from a long distance, you can look at it and name the mountain. You can say whether it is Mount Everest or whether it is Kanchenjunga. If you go very close to the mountain and look at the rocks, and only at the rocks, you may identify the chemical nature of the rock, but you cannot name the mountain, because you cannot see the outline of the whole mountain. The same thing is applicable here. When you look in low power, you can see the architecture together, and that is the easiest way to identify an organ. When you zoom into the organ, you see details of the cell like nucleus, mitochondria that are present in every other cell, and that does not help you to identify the organ. So higher power magnification is mostly for academic interest. For identification purpose, it is a low power magnification that should always be used. I hope this makes sense to you. And the take-home message is, if you cannot identify an organ in low power, you will never be able to identify the organ in high power. It is like saying if you cannot name the mountain from its picture, you cannot identify the mountain by looking at the rocks. That is not possible. So the same principle applies in histology and histopathology. Diagnosis must be made in the low power. Confirmation may be done in the high power. But if you try to diagnose in the high power, most of the time you will not be able to diagnose. So this is one trick that you should keep in mind. Let us quickly revise through this portion, and then once this is done, we'll start with the pathology portion, histopathology. Name this organ. Now this is done, so I'll not explain. You will name the organ. What is the name of this organ? Very good. So it is an organ having stratified squamous epithelium, skeletal muscle, and some gland. So this is the tongue. What is this organ? Very good. This is the esophagus. Stratified squamous epithelium, submucous layer with mucosa-associated lymphoid tissue and gland, and smooth muscle layer. So this is esophagus. What is this organ? Wonderful. This is the stomach. So there are gastric teats lined by columnar epithelium, tightly packed gastric glands, and smooth muscle layer. As we move towards the antrum, the gastric teats become longer and longer. What is this organ? Wonderful. This is the small intestine. We can see here there are givas projections lined by columnar epithelial cells, below which there are glands and smooth muscle layers. What is this organ? Large intestine or large gut. There are crypts, below which there is lamina propria and mucosa-associated lymphoid tissue. Identify this organ. Very good. This is the appendix. So we can see the mucosa and submucosa containing glands and crypts. There are submucous lymphoid follicles, and then there are smooth muscle layers intersected with adipose tissue. Identify this organ. Very good. This is a salivary gland, as it contains mixed mucus and serous components. So this is probably the submandibular gland. This probably is the parotid gland that has mostly serous components. And this is probably the sublingual gland that has mostly mucinous components. What is this organ? Liver. This is so characteristic of liver. So we have eosinophilic polygonal cells arranged in a specific pod-like pattern, and there is presence of central vein and portal triad. So this is the liver. What is this organ? Very good. It is an organ showing multiple serous acini and that are draining into a duct lined by cuboidal epithelium surrounded by smooth muscles. And there are also clusters of different looking cells with blood vessels in them. So this is probably the pancreas with the exocrine and the endocrine parts. What is this organ? Very good. This is the gallbladder. We can see irregular undulating mucosa lined by columnar epithelium, below which directly starts the smooth muscle layer. There is no submucous layer or lamina propria or muscularis mucosae. Sorry. And so this is the gallbladder. Identify this part. The only organ in your syllabus that has a cartilage. Very good. This is trachea or bronchus. Identify this organ. Wonderful. This is the lung. What is this organ? Very good. This is the structure showing glomeruli and renal tubules. So this is the tubule with a star-shaped lumen. The ureter. Very good. What is this organ? So it's an organ with transitional epithelium, underlying which there is smooth muscle. So this is the urinary bladder. What is this organ? Very good. There are seminiferous tubules containing various stages of spermatogenesis, and in between the tubule, in some places, there are interstitial cells of Leydig. So some of these cells are interstitial cells of Leydig. What is this organ? Very good. This is the vas deferens, a central lumen that has two layers of cell and surrounded by smooth muscles. Identify this organ. Very good. So we can see glandular elements, and there are fibromuscular stroma, and the fibers of the muscle and collagen run in different directions. So you can see glands of different shapes and sizes, flower-like or star-like glands, and these glands are surrounded by a fibromuscular stroma. This fibromuscular stroma runs in different directions. So this is the prostate. On closer examination, the cells are lined by two layers of epithelium, a basal layer and a columnar layer. What is this organ? Very good. This is the ovary. It contains a dense stroma, very small primordial follicles, and one developing follicle. Therefore, this is the ovary. What is this organ? Yes, this is the fallopian tube or uterine tube. It shows a highly convoluted mucosa projecting into the lumen and surrounded by smooth muscle. So this is the fallopian tube or the uterine tube. What is this organ? So it shows endometrium containing glandular elements, and it also shows a thick myometrium. Such a thickness of a smooth muscle is not seen in any other organ that you have in your cerebus. So this is the uterus. And the endometrium may be in proliferative phase, where the glands are round, compact with dense stroma, or maybe in secretory phase, where they are tortuous or twisted with a less dense stroma. What is this organ? Very good. This is the placenta. It shows bits of the placenta where there are villi, and the villi are lined by cytotrophoblast, which is present on the inner aspect, and syncytiotrophoblast on the outer aspect. What is this organ? Very good. This is the umbilical cord. You can see two arteries and one vein, and that is placed in a gelatinous material called the Wharton's jelly. So this is the umbilical cord. Identify this organ. Very good. This is the breast or mammary gland. It contains fibrocollagenous stroma, glands, and adipose tissue. And the glands, when seen very closely, show the presence of apocrine changes. So these are the primary tissues, and now we will get into discussion of how to identify diseases in the tissue. The first step to understand that there is some sort of a disease in the tissue is to understand what are the changes that are present in individual tissues. Yes, Animesh, you are asking how to remember. Now, I told you the only way to remember is to understand the functionality of the organ, the way I said, and then also to understand and prepare for the easy points by which you can recognize it. I have actually gone through the easy points only. There are some that could not be covered here, but I'll cover that in the study material. So I'm moving to the other part now, and if you have confusion, you can always stop that. There is no problem. So in surgical histology, basically we examine post-operative specimens. Some specimens may contain both normal and abnormal part. Some specimen may contain only abnormal part. So it totally depends on what kind of specimen that we are dealing with. Let us start with some basic conceptions of pathological signs under the microscope. So, try this. This is a gut, large gut. But what is this material that has been pointed with an arrow? What is that kind of a material that is present? Think carefully. It's a heterogeneous material with multiple dots and hyaline substances. It's almost like some particles in a fluid. It's very good. This is sparse or exudate. That means dead WBC mixed with some proteinaceous fluid. So, exudate formation is the hallmark of which pathological process? Acute inflammation. In chronic inflammation, we do not get exudation. So, exudation is the hallmark of acute inflammatory process. So, this presence of exudate in an organ, therefore, under the microscope, indicates that the organ might be suffering from acute inflammation. This is a smooth muscle layer of the GI tract. You can see multiple violet dots there. What do the violet dots represent? They represent WBCs. Whether they are lymphocyte or neutrophil can be understood under high magnification. It indicates leukocytic infiltration or WBC infiltration. That is also a sign of inflammation. If it is neutrophil, it's probably acute. If it is mononuclear cell, it's probably chronic. So these are also signs of inflammation under the microscope. In this picture, you can see some cellular material and some amorphous pink material or hyaline material. What does this hyaline or amorphous material represent? Such a granular appearance with no cellularity usually represents necrosis. So this is the typical appearance of necrotic tissue. When cells die, their DNA and other acids are denatured, so the cell becomes more and more eosinophilic. Cellular outlines are lost, making them amorphous. There is no nucleus or sparingly some damaged nuclei, and this is how typically necrotic material will look like. So this is a biopsy from the colon. What do A and B represent? The previous one is, we cannot say it is not amyloid. We cannot also say it is amyloid. It is a hyaline material for sure. First of all, amyloid is more homogeneous and glassy. It is not granular in appearance. So from the texture you understand it's not amyloid. But if you have to confirm, then you have to do a spatial staining. Without spatial staining, we should not comment whether something is amyloid. So, what does A and B represent? See, it's a biopsy from the same organ. You should not be suggesting that the same organ has two types of glands side by side. A is definitely a mucus kind of gland. In B, do you think the glands have become irregular, large, and lined by hyperchromatic cells? Also see carefully, there are dark violet dots indicating increased mitosis in the cell. So it is probably a malignant gland or adenocarcinoma. So on one side you are getting benign glands or normal glands, and on the other side you are getting malignant glands with increased mitotic activity. These violet dots are mitosis. You do not get such a high level of mitosis. Also cells are looking extremely basophilic. So that is why probably you are dealing with an adenocarcinoma. What is the chemical nature of A if this represents a cancer? A is a pink substance. So what is the chemical nature of A? A is typically keratin. So that means it's a keratin secreting tumor, probably a squamous cell carcinoma. What is the identity of the cell that is marked by an arrow? Very good. These are giant cells. Cells having pink cytoplasm and multiple nuclei. These are giant cells. They are signs of chronic inflammation like tuberculosis. They may also be present in some tumors. So it is a biopsy from the liver. I don't want the diagnosis. I want to know what is the process that has formed the tissue called A. What is the pathological process? Very good. There is fibrous tissue formation in the liver. Fibrosis is known by various names. Fibrosis can be called fibrosis. For healing, it is called scarring. For reactive fibrosis to a tumor, it is called dysplasia. Fibrosis in a tumor is sometimes called a serous manifestation, and in liver it is called cirrhosis. But all of them ultimately represent the fibrosis process. So with this basic idea of different kinds of damages that can happen in organs, like necrosis, degenerations, and malignancy, we come into the discussion of organ pathology. When you want to diagnose histopathology, the first step is to identify the organ. Second step is to identify the pathology. So looking at this, what do you think is this organ? Very good, it is appendix. Now we have to see what kind of pathological process is happening in the organ. So you can see this is the mucosa, submucosa and muscle layer, and in the lumen there is this granular material. What is this granular material that we are seeing here? Exudate. So this is an acute inflammation of the appendix. What is the medical term for acute inflammation of appendix? Acute appendicitis. So this is your combined diagnosis. So this slide represents acute appendicitis. A higher power microscopic view shows neutrophilic infiltration into the smooth muscle. Identify this organ. So there are folds, villus-like folds, but directly below the lamina propria there is smooth muscle. There is no submucous layer. So this is the gallbladder. Let's see what changes are there. The gallbladder wall is infiltrated by violet ducts. However, there is no exudation. So what kind of inflammation might this be? Chronic. So what is the disease called? Chronic inflammation of gallbladder. This is chronic cholecystitis. And as I always tell you, you must know your syllabus. In your syllabus, the only disease from appendix is acute appendicitis. And the only disease from gallbladder is chronic cholecystitis. So if you can identify gallbladder, it has to be chronic cholecystitis. This is another picture of chronic cholecystitis showing undulating mucosa, then infiltration of lymphocytes. Sometimes the mucosa invaginates inside, forming a gland-like structure. This is called Rokitansky-Eshop sinus. This is very important because this might be mistaken for an adenocarcinoma. So it's important to know that it is sometimes present in chronic cholecystitis. This is very easy. What is this gland called? What is this organ? This organ is thyroid. Very good. It shows the follicular epithelium which is cuboidal in nature, inside which there is this eosinophilic hyaline colloid material. Now, you look at the pathology slide now and tell me what is the thing that you see here. The follicles are distended with colloid and the pressure is causing the cells to become flattened. So what is this disorder that causes enlargement of the follicles and thyroid gland? Very good. This is colloid goiter. So the name of this disorder will be colloid goiter. By the way, there is only one diagnosis from goiter, from thyroid in your syllabus. So it has to be colloid goiter. This is another picture showing follicles of different sizes lined by flattened epithelium. Identify the organ first. What is the organ? So we have branching glands present in a fibromuscular stroma with the fibers running in different directions. So this is prostate. You can see the number of glands and the density of the stroma has increased. It is not possible to see under the microscope always. Sometimes grossly also the organ increases in size. And this is called benign hyperplasia of the prostate. So this is a slide of BHP. The corpora amylacea are more abundant in such a gland because of the obstruction caused by compression of the enlarging gland. Here again, you can see that the prostate is lined by two layers of epithelium, a basal layer and a tall columnar layer. If this two-layer arrangement is damaged, then the problem that will happen is you have to assume that it has become malignant. So that is why looking into the two-layer arrangement is important. Not for your examination, because in your exam, prostatic carcinoma is not there in the syllabus. So if you identify that this as prostate, it is prostatic hyperplasia. Prostatic hyperplasia may not manifest very easily under the slide. The reason is, it will look like a normal prostate sometimes. But the size of the prostate was actually increased, because of which it was surgically removed. So it has to be seen grossly also, to see how the size has increased. Because both stroma and glands increase, so the ratio may not be changed. What is this? We have already discussed this. A tissue with a granular matrix and round glands with rich cell division going on everywhere. This is a physiological slide as well. It's very good. It is the uterus. In pathology syllabus, it is given as endometrium, but that is basically the uterus. So what stage of the endometrium do you see here? Is it proliferative phase or secretory phase? Round glands with dense stroma or convoluted glands? Very good. So this is the proliferative endometrium. If you go into the higher power, you will see there are round glands. You can actually see cell division happening. This cell is in a state of division. And the matrix is also richly cellular. This is the proliferative endometrium. So therefore, this is in which phase of the endometrium? What do you see in 6A? You can see elongated tortuous glands here. Therefore, this must be the secretory phase of the endometrium. This is another picture of the secretory phase of the endometrium. You can see tortuous glands and relatively less dense stroma. This is a high-powered view of the tortuous glands. They are lined by tall columnar cells having secretory vacuoles. The vacuoles before secretion lie below the nucleus, called subnuclear vacuolation. During secretion, they come above the nucleus and become supranuclear vacuolation. So we already know what this cell is. This is a giant cell. And for all practical purpose, we will assume giant cells to represent tuberculosis. Although that is not done in real life, We also do a acid fast test, but here histologically the presence of the giant cell will represent tuberculosis unless there are other features. So this is exactly how a tubercular granuloma looks like. Multiple giant cells and mononuclear cells surrounding the lesion with fibrous tang. The amorphous material in between is necrosis. Whenever you find this kind of granuloma, you understand that you are dealing with a tubercular process. The next step is to identify in which organ it has happened. In your pathology syllabus, there are 3 kinds of tuberculosis: TB lung, TB of lymph node, and TB of intestine. So you try looking for alveoli or lymphoid follicles or glands, and accordingly you will get your diagnosis. So what is the diagnosis for this? You can see the giant cell and the granuloma here. So we can see a granuloma with giant cells, and the surrounding tissue are alveoli. There is TB of lung. Very good. What is this? All the round things are the granuloma. So the round things being granuloma, all around we can find air-filled alveoli, therefore this is also TB lung. This is how lymph node looks like. So there is a capsule, there are lymphoid follicles, and if you find that there is a granuloma in the lymph node, then it represents a tuberculosis of the lymph node. So look into this slide. These are the granuloma and these dark cells are the giant cells. So what do you think the diagnosis is? So we can see here there are many glands, and out of these 3 organs, so many number of glands may be only present in intestine. So this is intestinal tuberculosis or TB intestine. So is this one. You can see granuloma here, and there are glands. So this is TB intestine. Next one. So what is this tissue? First identify the organ. So this is lung. Now in your practical syllabus from lungs, there are 2 slides: tuberculosis of lung and emphysema of lung. So if you don't find a granuloma, instead find torn alveoli, then this is emphysema of lung. But mind you, you must rule out that there is no granuloma, because even in tuberculosis, there may be emphysematous changes because of enzymatic damage. So don't just look for the damage of the alveoli. Rule out that in the slide you have looked carefully and there is no granuloma. And then you can call it emphysema of lung. So what is the diagnosis for this? Very good. This is emphysema of lung. First, identify the tissue here. What is the tissue that you are seeing? Very good. This pink cells arranged in cord-like structure are typically liver cells. And in between the liver cells, we can see cords of fibrous tissue running with lymphocytic infiltration. So what is your diagnosis? Diagnosis is cirrhosis of liver. What is the diagnosis here in 9B? You can see here cords of hepatocytes running. The architecture is totally disturbed. You cannot identify portal, triad or central vein, and fibrous bands are passing through the liver, dividing the liver into pseudolobules or regenerating lobules. So this is cirrhosis of liver. Very good. Identify the tissue and the diagnosis. What kind of change do you see in the organ? Very good. So this is the liver identified by the portal triad that is present in between. And there are some residual liver cells also. Some of the liver cells have undergone swelling or ballooning and filled with lipid substances. Therefore, this is fatty liver. What is the diagnosis for this? So you can see lobules of liver separated by fibrous band, and some of the cells have undergone fatty change. When there are two types of change present together, that is fatty change and cirrhosis together, then only the higher grade of change is reported. So suppose if a person is suffering from an accident and has also died, then the diagnosis is dead. The diagnosis is not accident and dead. So in a similar manner, when the diagnosis is fatty liver and cirrhosis, since cirrhosis is much more severe and an end-stage disease, you do not call it steatocirrhosis, you call it simply cirrhosis. Since hepatitis and steatosis are both reversible, they can be reported together. But when an irreversible process has already happened, the irreversible process becomes the diagnosis, not the reversible process. So even though there are fatty changes, since cirrhotic changes are present, the diagnosis will be cirrhosis of liver. So look into this tissue. There are glandular elements, there is a cartilage-like element. What is this that we are dealing with here? If it has to be a trachea, there should be columnar epithelium. There should be bronchiolar structures and smooth muscles. None of them are present here. This looks like a teratoma, but it is not a teratoma. It's a very close correlate of a teratoma. This is known as a mixed tumor or pleomorphic salivary adenoma. The salivary gland or the parotid gland has a So in salivary gland, there is a cell called the ciliate cell that can differentiate into epithelial components and chondromyxoid component. When these two components are present together in the tumor, it is identified as pleomorphic salivary adenoma. One thing that I am telling you repeatedly is that you have to know your syllabus. Many of you are giving me diagnosis. I'm not talking about the first year students. They are not supposed to know this. But the second year students, many of you are giving me diagnosis that is not included in the syllabus. What you are doing here is a differential diagnosis between the topics of your syllabus. Because honestly speaking, in the actual practice of pathology, you will always be given the site of the biopsy, from where you have taken the biopsy. That way you don't have to identify the tissue. You already know the tissue. You just make your diagnosis. So why in the examination we tell you the source of the tissue? Because the number of diagnoses is limited. So if you know the list of the diagnosis, you can easily do a differential diagnosis between them. If you make a wrong diagnosis, teachers will not be very angry. Class. So don't write something that is not in the syllabus. Can you identify this structure? Look into the structure and say, they look like glands, but the glands don't look like a usual gland. So what is this structure? This is a slide showing multiple glands. The glands are lined by multiple layers of epithelium, which is not normal. The cells are pleomorphic, some big, some small, and you can also see that the glands are extremely irregular. This is adenocarcinoma. Do not write poorly differentiated or well differentiated in your diagnosis, because that depends on various grading systems. Unless you do the grading, you cannot use such words. Also, to be very honest with you, this is probably not secret mucin, which it is doing. A poorly differentiated adenocarcinoma will appear as sheets of cells and can only be identified by special staining. So it is actually a well differentiated adenocarcinoma. This is another picture you see of adenocarcinoma. You can easily see the nuclei are so big. So there is a high nucleocytoplasmic ratio and the glands are all irregular. And they are lined by multiple layers of cells. So this is an adenocarcinoma again. This is another picture of adenocarcinoma. Cancer will typically look very violent. It looks as if the cells have become enraged with large nucleus, dark blue stain and irregular arrangement. That is typically how a cancer appears. Now this is an adenocarcinoma. You can really see that we get colline matrix, a fibrous matrix indicated. So what is the subtype of the adenocarcinoma that you will call it? This is desmoplasia, very good. And this is typically found in duct carcinoma of breast. So in the duct carcinoma of the breast, which was previously called serous carcinoma, so in the duct carcinoma of breast, you typically find an adenocarcinoma with dense fibrous stroma or desmoplastic changes. So this is the slide of duct carcinoma. It's a similar picture where there are adenocarcinoma arranged in gland-like pattern and sometimes not into gland-like patterns. So the differentiation of this tumor is actually poor, relatively poor. And there are dark fibrous bands running in between them. This is another picture of serous cancer, which is currently called duct carcinoma. Identify the organ first. The normal organ is on the left, the abnormality is on the right. Look into the structures and identify. You can see there is a round structure surrounding which there is a cleft and there are some tubular structures as well. So this is the kidney. Now in between there is a compressed tissue after which there starts the tumor. The tumor has pale cells with prominent nuclei and divided into septa. So what kind of tumor are we talking about? This is a clear cell carcinoma. Very good. So this is typically renal cell carcinoma or clear cell carcinoma. This is how the cells look like. They have prominent nuclei. Clear cells, you know why they are clear? Because they contain glycogen and fat that are washed away during processing in alcohol and xylene. So the cells do not take up any stain. So there are clear cells separated by fibrous septa, and there may be a remnant of the normal kidney tissue with the biopsy. So this is clear cell carcinoma. First, identify the organ on the left. What is the organ? Very good. The organ is testis. And on the left side, there is a tumor originating from the testis. You can see dark cells that are developing from the seminiferous tubules. And as they are developing, they will form sheets of cells, and their interconnecting sector will be with lymphocytes. So what is this tumor that we are talking about? Very good. Seminoma, the commonest tumor of testis. Clear cell, vesicular nucleus, forming sheet, separated by fibrous septa and infiltrated by lymphocytes. So this is seminoma testis. First, identify what kind of cells do you see here. What are these cells called? So many of these cells that are present here. These pink cells with multiple nuclei, what are these cells called? Very good. These are called giant cells. Now in your syllabus, there are two kinds of lesion that can contain giant cells. Tuberculosis and giant cell tumor. If it is tuberculosis, there must be a granuloma. But if there is no granuloma, an innumerable giant cell here and there, then you are probably dealing with a giant cell tumor. So this is a giant cell tumor. It was previously called osteoclastoma, but the terminology has been dropped because these are not derivatives of osteoclast. They probably form by fusion of the stromal cell. That is why the nuclei of this cell are similar to the nuclei of the background cells. So the current nomenclature is they are called giant cell tumors. Identify this tumor. There is a pink lace-like matrix, and within the gaps of the lace, there are multiple cells that are embedded, hyperchromatic cells embedded. Again, you are saying amyloid. Amyloid is not in the syllabus. It could be amyloid. Technically, you are not wrong, but it is not in the syllabus. This typically is the appearance, this lace-like fungal hyphae-like appearance, pink, dark pink appearance, is the appearance of the developing bone tissue called osteoid. And the dark cells are malignant cells. So, an interlacing osteoid matrix with intervening hyperchromatic cells is classical of osteosarcoma. This is the primary bone tumor osteosarcoma, also called osteogenic sarcoma. This is another picture showing the lace-like structure of the osteoid matrix, in between which there are violet colored cells. Can you identify the tissue, not the tumor? What is the basic tissue that you are seeing here? Very good. These are smooth muscles. Very good. So if it is a tumor from which you have got only smooth muscles, so it's a smooth muscle tumor, what will be the name of this tumor? Leiomyoma. Do not write uterus, because we have no structure here to support the diagnosis of uterus. So this is leiomyoma. Very good. This is a high-power view of the leiomyoma showing spindle-shaped cells with elongated nuclei. This is another very interesting tumor that happens in the abdomen. If you can identify the nature of the stroma, there is one typical organ which under high power shows a stroma like this, in which multiple cysts have formed. So what is the organ here? Can you identify the stroma? This kind of a dense stroma? Very good. This is the ovarian stroma. That is why I said you have to develop an eye for the ovary. And you can see multiple cystic structures here filled with mucin. So there are pink mucinous substances in the glands. That means that it is developing into a kind of a tumor, a glandular tumor that contains mucin. This is called mucinous cystadenoma. This diagnosis is called mucinous cystadenoma. All these individual spheres are cysts. If the cyst contains serous substance or watery substance, it's called serous cystadenoma. If they contain pink-colored mucinous substance, it is called mucinous cystadenoma. So this is the typical appearance of mucinous cystadenoma. If the cysts are very deep, you may not be able to see the whole cyst. So you will see the lining epithelium, which is a benign, regular, simple columnar epithelium, and in between there will be ovarian stroma. What is this tumor? It's a very characteristic tumor having a collagenous stroma and glands. Some glands are compressed to form slit and some remain in circular form. Yes, wonderful. This is fibroadenoma of the breast. In fibroadenoma of the breast, some glands become elongated. This is due to compression by the fibrous tissue. This is called intracanalicular pattern. And some remain circular. This is called pericanalicular pattern. Together, this pattern in a dense collagenous matrix represents the fibroadenoma, the most common benign tumor of the breast. This is another picture of the fibroadenoma, where the pattern is mostly intracanalicular. If this would have been a tissue, what would be the name of the tissue? Adipose tissue. So if this is a tumor, then what is the name of the tumor? So in pathology, if this is a tumor, then its diagnosis will be lipoma. You can see there is a capsule, there are fibrous septa going inside with blood vessels, and the tumor is entirely composed of fat cells. So this is a lipoma. This is a high-powered view of the fat cells in lipoma. Identify the structure or epithelium. What kind of epithelium or structure do these represent? Very good. Stratified squamous. That means whatever it might be, it is a stratified squamous epithelium. At the top of this, you can see there are keratinization. So this is keratinized epithelium. So probably this is skin and not from the mucosa. So keratinized epithelium that is forming finger-like projections like this. So finger-like projections are also called papilloma. So what is this? This is called squamous papilloma. Papilloma of the squamous cell. So this is called squamous papilloma, or that usually presents as wart. Squamous papilloma. And outside there is a thick layer of retin. This is called hyperkeratosis. Wonderful. This is the melanoma. The benign variety of this is called nevus, but in your syllabus we only have melanoma. So your diagnosis will be melanoma. You can call it malignant melanoma, but melanoma is always malignant. So both nomenclatures are correct. This is a high power view. For your examination purpose, any brown tumor is melanoma. Because no other brown tumor is in your syllabus. This shows a structure of skin, and under the skin there are collection of small capillaries. Some of the capillaries are empty, they do not contain any blood. So what is this about? What is the diagnosis? Bundles of capillary under the skin, many of them do not contain any blood. Very good. This is called capillary hemangioma. This is known as capillary hemangioma, a kind of a malformation of blood vessels. And this is an internal organ showing multiple blood-filled spaces. These are large and always filled with blood. So what is your diagnosis? Very good. This is cavernous hemangioma. So in capillary hemangioma, there are multiple small capillaries under the skin, and many of them are empty. In cavernous hemangioma, it can be in any organ. They are large blood-filled spaces, and they are almost always blood-filled. They are not empty. Sometimes even they can be thrombosed and hyalinized. As you will see here, the pink areas are areas of hyalinization. Then it starts looking like colloid. But you can easily differentiate it from colloid because the lining epithelium is not flattened cuboidal, and also there are so many other similar blood-filled spaces which should not be present in a colloid part. This is another picture of cavernous hemangioma. What is this tumor? You have a stratified squamous epithelium above and multiple keratin pearls below. So this is the classical appearance of squamous cell carcinoma. In squamous cell carcinoma, you find a net of apical tumor cells and keratinous pearls, also called squamous pearls. And at one corner of the slide, there may be a portion of the skin from which it has originated. This is also a skin tumor which looks more blue in color, and the cells come down forming dumbbell shapes. You can see that the outer cells are arranged parallelly and inner cells are haphazardly arranged. This is the typical appearance of basal cell carcinoma. So the squamous cell carcinoma typically originates from the upper layers of the skin, and that is why they are more pinkish because they contain more keratin. The basal carcinoma originates from the basal cells. It's more blue in color, and they come down forming dumbbell-like projections, as you can also see here. There's an outer palisading or parallel arrangement of cell and inner haphazard arrangement of the cells. So this is the arrangement of the cells. What is your diagnosis here? What all can you see? First, identify the tissue. Very good. The tissue is the lymph node. You can see a capsule. You can see lymphoid organs. Below the capsule, in the subcapsular space, we can identify some abnormal tissue that should be present in the lymph node. So, what is your diagnosis? Very good. This is a metastatic lymph node. And if you think the cells are glandular, you call it metastatic lymph node adenocarcinoma. If you think there are keratin pearls, you call it metastatic lymph node squamous cell carcinoma. If you cannot comment, just write metastatic lymph node. This is also another metastatic lymph node adenocarcinoma. So up to this, I think this was clear, and this is pretty much your syllabus. That is why I was going by the syllabus so strictly, because you should know what is in your syllabus, and only then the differential diagnosis is possible. So let us quickly review and conclude the session. By now you know what are the topics that are in your syllabus, and I will expect you to diagnose only from the list of topics in your syllabus. That will make your job much easier. Fine. So let us start. So what is your diagnosis here? Identify the organ and the pathology and then give your diagnosis. You can just write the diagnosis. Wonderful. So we have a GI tract structure with mucosa, submucosa, muscle layer, and the submucosa contains lymphoid follicles. In our syllabus, this must be the appendix. There is exudation in the lumen and neutrophilic infiltration into the muscle layer. Therefore, this is acute appendicitis. What is the diagnosis here? You should give the complete diagnosis. This is chronic cholecystitis. So you can see the histology of gallbladder because there is no submucosa, and the muscle layers and lamina propria are infiltrated with inflammatory cells. So this is chronic cholecystitis. What is your diagnosis here? Very good. This is colloid goiter. You can see the histology of thyroid. The follicles are distended, epithelium is flattened, and there is accumulation of abundant colloid. Therefore, this is colloid goiter. What is your diagnosis here? Very good. So histology shows structure of prostate. There is hyperplasia of glandular and the fibromuscular elements. Therefore, this is benign hyperplasia of prostate. What is the diagnosis here? This is proliferative endometrium. Don't write uterus because you are not seeing the myometrium here. This is proliferative endometrium. This is proliferative endometrium because the glands are circular, the stroma is highly cellular, and the cell division or the cell division activity has increased. So this is proliferative endometrium. What is this slide? Very good. This is secretory endometrium. There are tortuous glands and the stroma is relatively less cellular. So this is secretory endometrium. What is the diagnosis here? Very good. We can see granuloma with giant cells and central necrosis, and the background shows alveoli. So this is, don't say giant cell TB of lung. There is nothing called giant cell TB. This is tuberculosis of lung or TB lung. Accordingly, you can also identify TB lymph node. What is this? Very good. Granuloma with glands must be TB intestine. What is your diagnosis here? Very good. The broken alveoli large hair spaces, and mentally you remember there is no granuloma. Don't write that, and therefore this must be emphysema class. What is your diagnosis here? Cirrhosis of liver. What is the diagnosis here? This is fatty liver. What is your diagnosis here? You can find glandular elements, cellular elements, and chondromyxoid elements. Very good. This is pleomorphic salivary adenoma. What is the diagnosis here? Wonderful. This is adenocarcinoma. And what is this adenocarcinoma specially called? Adenocarcinoma with dense fibrosis. No, what is the name of the tumor? This is called duct carcinoma of breast, which was previously called Kira's carcinoma. Duct carcinoma. The duct carcinoma NOS that we talk about, this is that tumor. What is this tumor? Very good. This is clear cell carcinoma or renal cell carcinoma. Name this tumor. Very good. This is seminoma of testis. Clear cells with prominent nucleus, fibrous band infiltrated with lymphocytes. What is this tumor? Very good. This is giant cell tumor of bone. What is the name of this tumor? Very good. Lace-like osteoid matrix and intervening cells with hyperchromatic nuclei. So these represent, this is an osteosarcoma. What is this tumor called? Very good. This is a smooth muscle tumor, so it's a leomai. And what is this tumor called? Very good. This is a mucinous cystadenoma of ovary. What is the name of this tumor? What is the name of this tumor? Wonderful. This is lipoma. What is this tumor called? So this is not squamous cell carcinoma. In carcinoma, I am telling you why it is not carcinoma. Don't go by the keratin pearl always. You see, this is the basal layer of the cell. See carefully. So that means the outer margin of the basal layer must be the basement membrane. Now no cell has come from above to the fibrovascular area, to the dermis. That means basement membrane was not breached here. If basement membrane is not breached, if cells are not hyperchromatic, then this is neither in situ carcinoma nor invasive carcinoma. So this is a benign condition. There is only overgrowth of the keratin layer with some other additional changes. So this is squamous papilloma. It's a benign condition. What is this tumor called? Very good. This is melanoma. Any brown tumor in your exam? This is papillary hemangioma. And accordingly, this one will be called? Very good. These are large vascular spaces containing blood and maybe thrombus. So this is cavernous hemangioma. What is this tumor? This is squamous cell carcinoma. Now see, not because of the keratin pearl. You see, this is the epidermis, the upper dark area. The pale area is dermis. The keratin pearls are secreted by malignant cell. That means malignant cell must have come down from the epidermis to the dermis, because dermis does not contain squamous cell. It is this invasive nature that makes it a carcinoma. What is this tumor called? Wonderful. Basal cell carcinoma. What is the diagnosis here? This is metastatic lymph node. So these are the topics that you essentially have for the examination. And I hope that after I provide you with the PDF of this, if you look again and again, you should be able to understand these topics. And in histology, one thing is eye impression. So you have to look and understand. There is no shortcut way of learning the thing. So at first you have to learn in detail the way we discussed today, but then your eye impression should work, and looking at the tissue you should be able to identify the salient features. That is an art that develops with time. So this was today's presentation. I hope if you have any question you can always send it to us and we'll try to answer them. Garima, I think the class can end now and you can take over.
Yes, sir. Thank you so much, sir. I think we've understood histopathology so very well after all that work that we've put in from our side. I hope you guys enjoyed today's session. If you did, do let us know about the feedback in the WhatsApp groups you're a part of. Also, our previous master classes are recorded and are up on our social media YouTube channel. If you wish to go back and look at them, they're already up, and do hit the bell icon, like them if you do, and share and subscribe to our channel. We'll be back with another masterclass hopefully anytime soon. Do send in your suggestions, whatever you have regarding the next masterclass you want sir to conduct with us. And these are the social media platforms that we use. I'll just share my screen. So this is our Instagram handle where you can get our daily updates about our posts that we make. we have 8 different task forces working towards the same goal under GFC. So we do a daily basis post on different topics where you can get updates on medical related and general awareness stuff. So I hope please like our channel and follow us to be updated. Just one second. This is our YouTube. This is our Facebook page. That is how it looks like. So similarly, like Instagram, it is our Facebook page also runs the same way. So you can just go and like our page to be updated. And this is our YouTube channel where you see all our videos, not only related to Masterclass, but DFT's work in general is all up. So do hit the subscribe button and stay tuned. Today's session will be recorded and will be put up there. So if you want to go and watch it again, it will be up in a while. So make sure you're subscribed so that you don't miss out on the notification. Thank you, sir, and thank you everyone again for joining in today's session and making this, participating with sir, making it a successful one. Hoping to see you all very soon. This is Garima Dubey signing off from Doctors for Records. Thank you so much.